Namaste. I am Dr. Sudhir Kumar from Bokaro City. I am a practicing physician and most of my practice is oriented towards cardiodiabetes. Today's topic which I am going to deliver is latest update in hypertension. So WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to CVD, which affects 45% people in the 40-69 age group. Raised blood pressure is among the most important risk factors for CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% to 28% respectively. Despite that, nearly half of the people, or 51% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of men and more than 53% of the women living in hypertension did not get treatment. Medications was used to control poor blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. This is the data from WHO Lancet 2021 study. International Society of Hypertension has released the ICH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource-poor settings. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specifications of essential standards of care for low resource settings. The AHA-ACC has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low atherosclerotic CVD risk. Among low-risk adults, no ASCVD or 10-year CVD risk less than 10%, with stage 1 hypertension, blood pressure 130 to 139 systolic and 80 to 89 millimeter of mercury diastolic. Management starts with non-pharmacological therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacologic therapy. This is from Hypertension article 2020. Acute respiratory distress syndrome, or ARDS, is a potentially fatal condition involving lung damage, and experts often associate it with severe COVID-19. A recent study, which appears in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to 110 to less than 130 mmHg range substantially reduced CV adverse events in the STEP randomized trial, affirming the sprint findings for an older Chinese population. Among some 8,500 patients, ages 60 to 80 years in China, the intensive target trimmed 26% of the composite CV risk. Findings from now a second major trial supporting a lower target could unite the guidelines, which even among US professional societies range from threshold of 130 to 150 millimeter of H. With regards to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure measures, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on office BP measurements, but also on out-of-office measurements, such as ABPM or home blood pressure monitoring. 24-hour and nighttime BP measurements were associated with greater risk of mortality and a composite of CV outcomes. Thus, they may be considered as the most relevant measurements for estimating CV risk. For every 20 systolic or 10 diastolic mmHg increment of BP measured at night, the risk of mortality increases by 23%, and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European guidelines recommend, especially in the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination of ACE inhibitors or ARB plus calcium channel blockers or diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of unknown carcinogen, namely NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by the WHO, International Agency for Research on Cancer, to be carcinogenic in humans. Of 100,000 patients, would have received, if 100,000 patients would have received NDMA contaminated valsartan from Zhejiang Huai manufacturing unit, where the highest level of contaminants were found, every day of 6 years in the highest dose, it could result in 22 additional liver cancers over a lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 100,000 patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by a significant increase in the rate of emergency department visit of more additional 6%. The HYGEA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with significant reduction in endpoints. The HYGEA chronotherapy tested whether nighttime therapy is in comparison to usual upon awakening hypertension therapy exerts a favorable CV risk reduction. The largest study included a total of 19,084 hypertensive patients. During an average follow-up of 6.3 years, 1,752 participants experienced the primary CV outcome. An ambulatory BP measurement was performed for 48 hours to collect data on how BP differed during sleep. The RR reduction for CV events was significantly improved for nighttime treatment when compared with awakening treatment. Thank you.